Right, so welcome everyone. My name is Nikki Aiello, if I haven't met you before, and I'm a recovery and life transition coach. I work in, I live in Denver, Colorado, but I can work anywhere. And so I help people in recovery from not only substance abuse, but from anything else that's destabilizing. So whether it's a divorce or a dramatic move, even just a change of phase of life, going into retirement or empty nesting or whatever it is that can, throw you for a loop and you just don't really know where to start or how to get up or what your new priorities are, et cetera. So that's what I help people do in a very holistic way, which includes bringing in functional medicine doctors. I'm a huge proponent of mind body medicine and physical, mental, emotional, spiritual components all being addressed when returning to balance and health. So therefore, this is why I have my former doctor, Dr. Force, with me today because I really like to educate people about functional and preventative medicine because I think it's profoundly more effective and empowering than Western medicine. So we're going to talk about that in case you don't know what this is or if you just want to learn more about it. So you can find out more about me. I'll talk about me later if you want to learn about coaching and my yoga teaching. And I want to introduce Mark Force, Dr. Mark Force. He is a guest. I'm just going to read a little bit about him so he doesn't have to boast too much, and then then we can talk more to him. So this is my former doctor. I used to see him when I was in Phoenix, Arizona. He was my first doctor of this sort, and he's a DC, so a chiropractic physician in family practice since 1984, a diplomat of the International College of Applied Kinesiology, which he can talk about too. Kinesiology is amazing. He's a fellow of the International Academy of Medical Acupuncture. His practice includes chiropractic neurology, applied kinesiology, cranio-osteopathy, clinical nutrition, non-needle treatment of acupuncture, meridians. He's written and edited books, which I'll pull mine down from the shelf in a second. I have one up there for the public and the profession. He has published, researched, developed, and patented nutraceuticals, which are super awesome. He can talk about those and taught doctors diagnosis, clinical, natural therapies around the U.S. So sorry if I stumbled it all over that, but
Did good.
he's amazing. And so yes, welcome, Doctor. I call him Dr. Force, but I think that he might go more by Dr. Mark now. I'm not sure. What do you prefer?
Either one works great.
Okay, cool. Well,
Yeah.
you live in Ashland, Oregon now. Your practice is there.
Yep.
Do you want to talk about what you're doing now, what your practice is like, and et
Yeah.
cetera?
So I sold my practice about 5 years ago, and then took a few years off for sabbatical to spend time with my wife and family and catch up on playing, and then a couple years ago started back up in practice here in town, and now I practice with Hannah, my daughter, who's doing the same work that I do basically, and also doing a lot of work with young kids. And she's almost licensed as a midwife, so she's taken that path too.
That's
So
amazing.
yeah, so we're practicing together, which is really sweet.
That is sweet.
So,
She worked on me. I worked with her a little bit before I left Phoenix. She was coming
yeah,
into your practice there.
yeah.
And I will say that I lived in Ashland, Oregon. I had a little stint there 4.5 years ago in between moving back from LA to Denver. And it's like the most magical place on the planet. So
It's pretty sweet up here.
it's unlike any place anywhere. I mean, it's the energy is so great and the people and everything. So that's especially cool. Well, let's dive right in if you don't mind. Hours fly by
Uh,
fast.
let's
I'd
do it.
love I'd love for you to talk about what functional medicine is.
So functional medicine is the approach where you look at body systems, you look at systems functions in the body. So you look at the nervous system, you look at the body chemistry, you look at organ functions, you look at these different things, and your intention is to optimize their function. So the orientation is a little bit different than with traditional medicine. In traditional medicine, it's more oriented around what is the vector of the disease, how do we get rid of that vector, how do we get, so the vector would be like a virus or a bacteria or the effects of an injury, things like that. or what is the pathology? How do we need to manage or treat the pathology? So in functional medicine, your approach is a little bit different. So you think in terms of what do we need to do to restore the body's innate capacity to regulate itself and restore its functions to optimal so that it's able to do all the things that it's supposed to do, like heal, like maintain its health, like present resistance to infection, all of these things that it normally should do. And so the approach, sometimes people have a little bit of a difficulty getting their head around the approach because, someone comes in with ulcerative colitis, and then why am I treating their adrenal function? They might not, it's hard for them sometimes to make that connection, why we're doing that. And so there's a little bit of an education process with that. So a lot of docs that practice functional medicine actually don't understand the concept, interestingly enough. There's a lot of what some people call green allopathy. Allopathy is traditional medicine. So there are a lot of people that they'll take a weekend course in functional medicine. Doctors will do that, and then they'll say they're practicing functional medicine, but all they're doing is giving an herb for a headache rather than a drug for a headache. But they're still not thinking in terms of why do I have that headache and what do we need to do to really solve that process, really restore the body's innate regulation.
It's kind of like how I think you even told me this once, to get your doctorate, you really, at least whenever we talked, you only had 20 hours of nutrition out of however many hours of medical education.
Yeah, typical in medical education is 5 to 20 hours, somewhere in that range of nutrition. Yeah, there was a lot more in the chiropractic school that I went to.
Well, right,
Actually,
for you. I was just talking
yeah,
about the Western, approach versus, the more of the holistic
yeah.
functional approach.
Most conventional docs have had very little background in nutrition, and so oftentimes I'll run across a patient that I'm working on concurrently with another a conventional physician, and they'll make certain statements about what I'm doing, about that I might not know what I'm doing because I'm recommending this for a patient. But when they do that, they end up making it really apparent that they don't really know what they're talking about, because they just don't have the background.
Right. Which
Yeah.
frustrates me incredibly. Hey, before we go further, will you adjust your Instagram
Yeah.
pictures so that you're in the middle more? You're kind of off
Sure.
to the however you need it. Yeah.
Is that better?
Yeah, and then you just have to block that. Yeah,
Yeah,
perfect.
I'm
You're gonna
trying
have
to
a
block my.
halo. Yeah, if you just kind of stay in that vicinity, you'll be pretty good. You can turn it just you look at yourself. If you start to get real bright, then we'll
Yeah.
fix it. Okay. Um, so how do you then go? Well, a couple things. So I think a lot of people get confused between like, oh, I have a naturopath, I have a holistic doctor, I have a functional medicine doctor. Like, you know, I feel like I know the difference, but I'd love for you to talk about, when people are talking about who is a functional medicine, who can be under that umbrella.
Yeah. Right. So
Doctor, I meant.
So in terms of functional medicine, there are a number of organizations that teach that approach and that are quite good. And so you can have MDs that have a real clear picture of how functional medicine works. And whereas you can have a naturopath or a chiropractor or an acupuncturist that doesn't really. So it's not exclusive to a certain discipline. It's more that it takes study to understand the bigger picture of how the functional approach works in a system. So, there are some MDs that I've learned incredible tools from that add to my functional medicine practice. Mm-hmm. So say for instance, I'll give you an example of an MD who really understands functional medicine. So I just recently read a book that's quite phenomenal. It's mitochondrial dysfunction. It's B complex thiamine deficiency, dysautonomia, and high calorie malnutrition by Derek Lonsdale. So Derek Lonsdale is an MD, and he was at one point the chief pediatrician for Cleveland Clinic for 20 years. So he was dealing with kids with real severe and even life-threatening genetic disorders, and trying to find a way to manage them and try to find a way to get these kids to where they could function somewhat normally in life. And he came to the realization that these really circled around two main areas. One is mitochondrial function, where you produce energy in the cells for them to function properly. And then the other is methylation, where you transcribe genes to enzymes. So at this real basic level of cellular metabolism, he realized that that's where these conditions that he was trying to come up with answers for these kids revolved around. And so it wasn't about giving the right drug or the right combinations of drugs. It was about trying to promote, it was about understanding how to promote certain enzymes in the body so that the body could function better. So that's an example of an MD who has tremendous understanding about functional medicine. Whereas oftentimes I find that there are docs that have switched to using a lot of herbal medicine, for instance, but they use the herbal medicine in a symptomatic fashion. So they will give a given herb for a stomach ache or a given herb for a headache, but they don't really dig deeper to understand what the process is that leads to the headache or to the stomach ache. So and the way the body's connected, there's a lot to look at. There are a lot of connections to look at. You know, it can get really complicated.
So would you say it's just a lot of it is just education? It's just there's not, you don't go to school to be a functional medicine doctor. You just you get whatever discipline or license you want to, you know, get, and then from there it's just education, education, education for your specialty and beyond.
There's truth in that. There's a lot of education. It goes on and on forever.
Would you say that functional medicine, like sometimes I think that name, like the name makes sense-ish, but do you think there's a better name?
Well, I've been wrestling with that because I lecture a lot to docs, and I propose different ideas for functional medicine because to a great extent, functional medicine is not understood, like you said, and then to another, it's been degraded by docs that apply it in a way, you know, they try to sell cosmetic medicine as functional medicine, for instance, you know. So I've proposed systems-oriented medicine, because that's really what you're doing is you're normalizing systems. Mm-hmm. So if you take a systems approach, and I like the contrast between a systems approach versus a symptom approach. So the work that I do is a systems-driven approach. It's not a symptom-driven approach. In fact, when you're trying to come up with solutions for people, a lot of times most of the time, you have to put the symptoms aside. It's really important to understand symptoms, and certainly my goal is to give people relief from their symptoms.
Right.
But if we become too focused on the symptoms and we're oriented towards addressing those, we can get lost to what really needs to be done to restore a person's health, you know, and then become bogged down in piecemealing, treating this, that, and the other thing, rather than focusing on what needs to change for people to heal, you know.
That poster that you used to have in your office, you probably have in your new one of the iceberg. You know, it's just a big, beautiful ocean with this much of the iceberg showing, and then it was just like the rest was down here. So,
and that's everything behind it that you have to address, behind the symptom. Yeah.
So, what's your approach to that? What's your approach when somebody comes in? Is it lab work? Is it where do you go with all that?
Data is really important. So when you use this type of approach, knowing a lot, having a lot of data to work with is really important. So you understand the bigger picture and you can make the connections between things. And so if someone's coming in, so there's a distinction between someone coming in with a very simple kind of acute problem versus the patient who has a chronic and complex illness. Okay, there are two different ways of approaching people. And my area of interest is the complex and chronic patient, because that's the person who gets dropped through the cracks. You know, they end up not knowing where to go because they've been everywhere and they've not gotten any answers. And no one's been able to really define what it is that they have and how to treat it. And so my experience has been that it's incredibly satisfying to give people answers for that, you know, and to see their lives change. And it can be really complicated to do that, but it's a really gratifying thing to do. You know, I just worked with a gal I just did re-exam on a gal who has bipolar disorder, and she suffered with it her whole life, and she's in her 50s now. And we've been working for not that long, and I did a re-examination on her today, and her, everything's lining up. All these
Re-examine of
neurological,
what sort?
eye,
Re-examination
ears,
of what
nose,
sort?
throat, heart, lung, abdominal, dynamics of blood pressure, um, looking at the neurological exams and seeing her functions improved or normalized, and for her to be able to see that, and for her to be able to tell me that she's weaning off her medications and she feels better than she has in 30 years, is a beautiful thing. And to see her coming in and, she has light, she's not surrounded by darkness anymore. She's surrounded by light. And that's a beautiful thing, you know.
Well, I'm sure you
And
saw that to some extent with me, working with
I
me.
did. I did, and it was beautiful.
Hmm.
It is beautiful.
Hmm.
So that takes a lot of data to do that. So, our goal is a goal where we want to see a person thrive emotionally and spiritually and physically, right?
Hmm.
And to do that, we at a basic level, we have to get very down and dirty.
Hmm.
I have to understand what the lab work is. I have to understand what the physical exam is. I have to look at health questionnaires and graph those and do all kinds of testing, like do phonocardiography where I measure heart sounds, do EKGs, do heart rate variability so we understand the functions of the autonomic nervous system, where we do neurological exams and we can look at cerebellar functions and these other functions and see where people are. Having that information is really important to see people get better. Even doing genetic curations, sometimes it takes taking 23andMe data and loading it into a database and breaking it down so you can understand the crucial enzymes that are underexpressed in that person. To find the crux of the thing for people is really important
Do you
because
have that? Sorry, go ahead.
it gets beyond treating the symptoms, right? Yeah.
Do you have all of that? I mean, I remember you having quite a bit of equipment when I was there,
Yeah.
like the heart monitoring and all that kind of stuff. But the genetic, the genomic or DNA, whatever you just
Yeah.
said, do you
Yeah.
have that kind of stuff too, or do you have to send that out?
Yeah. So I can take 23andMe data and load it into a database and then do analysis of that and establish, what the key issues are we need to test for a person.
Wow.
And then that's where the applied kinesiology really shines, is not when you just start testing someone with applied kinesiology blind, but when you have all of this data, all these different systems and how they're working, the weak links in their systems, and
Hmm.
then you can pick it apart.
Hmm.
Like, say if you take, for instance, a real common reason people have bipolar disorder,
Yeah, let's
talking about
talk
this
about
one
that.
patient, is an issue with the balance between glutamate and GABA in the central nervous system and how it's regulated. And a lot of that can be affected by genetics. And so even if you get down to the point where you're real clear from the genetic curation that there are certain enzymes that are underexpressed that you need to look at, there are still a lot of moving parts in there. There's still a lot of different nutrients that could affect the expression of that enzyme. So you want to avoid just throwing the kitchen sink at people. You want to be real targeted. So that's where the applied kinesiology can then come in, and you can test a person for the 12 different variables in that gene that you want to support.
Can you give an example of that? First of all, tell people what applied kinesiology is, and then
Yeah.
in that specific example, if you could say
Mm-hmm.
12
So
different
applied
whatever.
kinesiology is a form of neurological testing where you look at how a person responds to different stimuli, and you look to see whether or not that's within normal parameters or not. So say, for instance, if we look at chemistry, a person should be able to smell, for instance, chlorine and not have them throw them out of balance. They should have enough reserves where they are able to adapt to that, and it doesn't throw their system off. But a real common relationship, if you have a person smell chlorine, and if it causes global inhibition of muscles in their body, then that's adversely affecting their nervous system. And then the most likely correlation to that is a need for essential fatty acids, something like omega-3 fatty acids. And then if you supplement that, you'll be able to see that they will become tolerant to chlorine then. as an oxidant, and they're more stable. It'll control inflammation in their body. It'll balance a lot of different systems. So that's an example of using applied kinesiology testing chemistry.
So would they be smelling the chlorine and then you would be doing a muscle testing on them?
That's correct.
You'd
Yeah,
like press their arm would press against yours when you're smelling it and then when they're not, sort of thing?
that's correct. And so I know a lot of people advocate testing substances just by touch, holding them on the body, but it's not a legitimate way to do it. The way it's done is by smell or taste. So it's actual chemical stimulus that you're checking the person's
I
ability to.
remember you pouring powders in my mouth.
Yes, I'm sure you do.
And we just talk a little bit more because a lot of people don't know what this neurological testing is with muscles. Can you just, I gave one example, but we just talk a little
Yeah.
bit more about it?
So
I do this
well,
because I remember you touching different
yeah.
dopamine, serotonin, and then so it's just a
Yeah.
reminder.
So the idea on the body is that the body is adaptive. You know, it's strong, it's resilient, it adapts to stress. That's the ideal scenario for a person, is that they're robust and they adapt to the environment. And so in applied kinesiology, basically we're testing that ability to adapt. So say, for instance, an example of a physical correlation is that a lot of people have recurrent upper neck problems because they have an imbalance in the muscles of the neck. And that's commonly because of needing craniosacral work, because certain muscles of the neck are out of balance because of a need for craniosacral work. And so they have chronic neck problems for which they see a physical therapist or a massage therapist or a chiropractor for, but it keeps recurring. And so if you're able to test those muscles related that are affected by cranial nerves and find that they relate to a need for cranial adjusting correction, cranial osteopathy, you can normalize those nerves, and then the muscles of the neck are strong, and then the neck functions the way it should, and that chronic neck problem isn't there anymore. So that's a physical correlation. As far as a systemic correlation, you know, the example with the chlorine, smelling chlorine, and it causes a person to weaken, whereas normally you should be able to adapt to that, and it shouldn't be a problem. Another example is testing a person for what might strengthen them. So in the body, there are reflex relationships. So as you develop, let me know if I'm getting too out of
I will. I will.
off.
I think you're
Okay.
still very understandable to everybody.
Okay. So the way the body works is the nervous system basically reads every part of the body, every function of every part of the body, and then feeds that into the central nervous system to determine what it's going to send back out as far as commands. You know, it has to have good information to work with. In fact, that's so important that 2/3 of the nervous system outside of the brain and spinal cord has to do with what's fed back into the central nervous system rather than what comes out.
Can you say that one
So
more
the
time?
nervous, yeah. So you have what comes in from the body, every part of the body, whether it's your stomach or your foot or your neck muscles or whatever it is. You have afferentation, which is the nerve information that comes into the brain and the spinal cord. Okay. And then you have the information that comes out from the brain and the spinal cord to the different parts of the body that controls how they work. Okay. So that's called efferentation. And only 1/3 of that system has to do with what goes out, and 2/3 has to do with what goes in, because it's so important for the brain to know what's happening. Okay.
Mm-hmm.
So part of that system is to be able to relate all of the different systems together so that they coordinate. Because you have to coordinate the stomach with the small intestine, with the large intestine, with the pancreas. They have to work together. Okay. So that's why that information is so important. So the brain knows how to coordinate everything together to work together in harmony, you know. And so as part of the way we develop, there are reflex relationships. So as we develop, there are certain levels of the spinal cord that develop into different systems. And some of that may be a muscle in the hip that relates to the large intestine. And so if the large intestine doesn't function properly, that muscle won't function properly. And you can test that. So then if you find that muscle doesn't function as it should, You can test for a reflex point on the body that is reflexly related to the large intestine. And then if that muscle tone changes, there's a relationship between that muscle and the large intestine. Then you can start testing to see how it relates to other systems or what you might need to do to strengthen that system. So you might give the person a probiotic and then find all of a sudden that that muscle then tests strong, and that you're able to do an abdominal exam and find that there's less tenderness in the large intestine, or there's less tenderness in that muscle related to the large intestine. And in that way, you can get information that's otherwise really hard to get. Because commonly what happens is that even when you've done a history, you've done a review of records, you've done laboratory, you've done a physical, orthopedic, neurological exam, you've done all these things, oftentimes there are still questions. You don't have the final answer yet. There are still a number of possibilities. So by having that to work with on top of everything else helps you drill down to what the essential is, what the core issue is. And it's really powerful when it's used that way.
That is really powerful.
Yeah.
It's got to be really hard for a lot of people to comprehend that. I mean, there's just got to be, there's so much knowledge behind that.
There is.
Like, how long have you been
It takes
practicing?
36 years. And I've been lucky to have, I've been so blessed over the years to have so many mentors that are just incredibly gifted, that have given to me, and helped me get to the point where I am. And so now my job at this point is to teach and share,
Are you teaching it? What capacity are you teaching in right now?
Well, I'm mentoring Hannah, because she's new in practice.
Right.
Yeah, and then in the last few years, I've written some reference manuals or been a contributor to chapters for reference manuals for the physician. And then I'm starting in the end of this month, in the end of August, I'll be starting an 8-month course in applied kinesiology down in the Bay Area, in Santa Clara.
So will you be
And
traveling, commuting down there?
yeah,
Yeah.
just going down there once a month to teach. And then Hannah will be coming down. And then what's beautiful is that my youngest daughter, Tanaya, I don't know if you ever met Tanaya.
I don't think so.
She's in her 3rd year of chiropractic school, and she'll be taking the course too.
That's
So
amazing.
it'll be a really sweet thing.
A whole family of doctors. That's really, really cool. Lucky, lucky
Yeah,
girls,
yeah,
lucky
very lucky.
everybody.
And so my goal now is to take the knowledge base that's been given to me, and to put it into format where it can be perpetuated.
Yeah.
And I'm working on doing that have one direction that's for the physician, and have another direction that's for the layperson. To expand on that book that you have.
I'll grab it.
And, yeah.
I've actually had a few copies because if you remember, I had you, speak at the yoga studio I went to, and
Yeah. I'll
I
send
gave.
you the newest copy.
Okay, so this is it. Elements of health, choosing health, and I have all these little tabs and stuff in there because when he gave me different, you learn what's happening as you're working with your doctor, which I just think is amazing. It was my first time, developing a partnership and a relationship, and
Yes,
an
that's
empowering
really important.
one.
Yeah.
Yeah. So,
That's,
you told me to, you suggested, glutathione or whatever. So I go in here and I see what that is, and what it does. And then, you also have more spiritual type stuff in here. So not spiritual, alternative medicine type things, explanations of, um, the different modalities that you use, the acupuncture and everything. And then there's just so much. It was very helpful and empowering, and I referred to it a lot when I was working with you and beyond that.
that's beautiful. That's beautiful.
Yeah.
That's what it's for.
And I think that's why I'm doing this. I was talking earlier about how I'm a life transition and recovery coach, and especially if you're coming from substance abuse, there's a big biochemical aspect to recovery. I mean, almost all of us need to come back to some sort of biochemical balance, but it's even more pronounced there. So I recommend to all my clients that they find a functional medicine doctor and start with lab work, start with assessment. It's like taking your car in to get a diagnostic.
Most
Rather
definitely.
you have the ideas like, I've heard that a carburetor sounds like this, and that must be what's happening in my car. It would be like something intuitively, I feel like this, but like usually we're wrong about that stuff. So it's like you go in, you get it on paper in, like clear where your imbalances are, and you have somebody like you read through, and then you're not shooting in the dark. And it's so all of the other things, all of the other transitions and like working with a psychologist or psychiatrist or a therapist and, Reiki practitioner, whoever it is you choose to work with, when you get the foundation, the fundamentals more in line, then everything just flows easier. Recovery is not fun or easy for anybody, and you might as well make it swift if possible. And it's just that's the foundation for me anyway, was well, for me it was, seeing you and yoga and nature and all these different aspects, which I help people get together. But it's such a big deal to me when I bring it up, like functional medicine. That's why I kind of wish there was a different name for it, because it's just like, it just kind of goes in one ear and out the other with some people because they
Yeah.
maybe just think it's some other, I don't know. There's just so many different types of practicing these days, and it's so hard to, you know, crack, get through that really hard formed idea about
Yeah.
Western medicine and the approach to health.
Yeah. Yeah, it's interesting that
Drives me
functional
crazy.
medicine name, at some level, it's real accurate. In other
Yeah, it's
ways,
accurate.
it doesn't. It is technically it's accurate, but it doesn't convey somehow.
Yeah,
Yeah,
like it just needs to
enough
be
of it.
called real medicine, like real.
Real
And
medicine.
everybody knows that it's like this is the real deal, and this is the system illness approach. Like, our
Yeah.
medical system, it's
So
based on people being sick.
yeah. So the ideal is that we integrate together and we use what each type of medicine has to give,
Yeah,
and we don't see one as necessarily being better than another, but we look at it more in terms of what's appropriate for that person at any given time.
right.
And sometimes bringing them together is really beneficial too.
I'm
And
a
so
fan of that for sure.
yeah, sometimes working concurrently with conventional medicine along with systems-driven medicine or functional medicine is
Mhm.
really a good thing, So I think at some level we need to get beyond judging one as being necessarily better,
Right.
but in terms of which one is most appropriate for people, for any given situation.
Well,
Yeah,
and I'll just say from my own personal experience, like I do believe there's a place for everything. I believe I can go on a tangent about pharmaceuticals too, but my experience with Western doctors, I have seeked out some really, really great ones because I know many have left their own private practice like yours because they're just so sick of dealing with the administration and they go into the
yeah,
other realm. So I have seeked out many that I feel have continued with their education and are incredible doctors and
yeah,
work in the hospital and, healthcare system setting.
yeah,
I've been frustrated with just their approach to preventative and the standards. Like when I've gotten tests run, I've done a comparison with the analysis that my functional medicine doctor has given over my lab work and then
yes,
my other doctor. And it's like they seem to have completely two different standards of when changes need to be made. So I feel like Western, my doctors at Kaiser, for example, sorry to bring up a name, but it's like only when you're at the point of illness is it like, okay, we need to treat something versus like over here
yeah,
with you, that you can start to see an imbalance and you address it early. And so that's where my
yeah,
frustration comes in.
yeah. So let's talk about that. That's a really good point of conversation. Okay. So the standard lab values are based on average populations of people. And typically what's done is you consider the 90th percentile to be normal. So say you run 5,000 people just off the street blindly, and you assume that the 5% at the top and the 5% at the bottom are abnormal, and the other 90th percentile are normal. Well, my my standard argument is go to the grocery store, walk around. Are 90% of the people in there healthy? Not usually. So if you took them as a group and tested them and assumed that 90% of them represent healthy, it's just not true.
Can I share
And
with you
so
my
what you have
favorite
to do,
quote? Let me have to
Go
stick
ahead.
my quote in there and then you have to finish because this is
Yes,
right on
please.
there. Um, it is no measure of health to be well adjusted to a profoundly sick society.
Yeah, it's a good point for sure.
There we go. And that is Krishnamurti. You probably know him.
Oh, Krishnamurti, sure.
Hmm. Okay, keep going.
So there's another way to do lab normals, and that's to pre-screen people for being a healthy subject. And what you do is you only put healthy subjects into your your standard to the group that you test to come up with your lab standards. And so when you do that, you come up with different parameters that are narrower. So it's really common to say for blood sugar, normal is between 70 to 105, for
Hmm.
instance, or 100. But if you look at a healthy group of people, it's going to be more, it comes to be around 80 to 95. It's a narrower range. And so when you start looking at things like that, then it becomes more useful. And then
That's
some
so
of those
interesting.
things are narrower, some of them are wider. For instance, the 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 trend with total cholesterol has been to have it become lower and lower over time. But if you look at the research, it's not very well supported.
Hmm.
So a lot of the research that supports the lower cholesterol normal level is driven by pharmaceutical companies that run studies to prove that the cholesterol normal should be lower.
That's a frustrating area for sure. That's one of those
Yes,
areas where, yes, I believe there's a place for everything. And I take pharmaceutical medication. So I believe there's a
yeah,
place in my life, but I also think
for
it's a
sure.
really corrupt industry. And it's like that's another thing. We have to empower ourselves to get the right education so we're not like victim to that.
For sure. If anything, the like say for instance having that book is to have a person get to the point to have you get to the point where you're your advocate and you're educated enough to be your own advocate. You're educated enough to be your own contractor for your health care.
Did I ever drive you
And
nuts when I came in and said, well, I think I need to do this? Well, this says this, and I probably need some more of this. And I think I was pretty overzealous.
sometimes I end up having arguments with Dr. Google in the office, yes.
Dr. Google. That's great. It's handy.
Yeah. It is really handy and at the same time you have to know how to vet the information
Yeah.
properly.
Yeah, yeah.
Yeah. So
Um,
oftentimes I'll read research studies that conform to my prejudice, for instance, my preconceived ideas about
mhm.
how a nutrient should work or whatever. And I'll
Yeah.
get into the study. I'll be really excited about it, and then I'll get halfway through the study, and I'll say, "This is just junk. I can't stand on that. It's a poorly designed study. It doesn't really prove what it started out to prove, or what it's trying to observe, rather."
That
Yeah,
probably happens a lot because people are just
it
always
happens a lot, actually.
publishing.
You have to, yeah,
Well, that's
have
really
to be
interesting
careful.
about the standards, learning that about the standards, the 5%
Yeah,
lowest and highest, and actually, no wonder. I mean, we live in a really pretty sick, health is
yeah.
not, our strength in the US.
So you have
So,
two ways of looking at lab.
yeah.
One is at the standard normals. Is it
Hmm.
within the standard normals, which is important too, because if you're outside of the standard normals, then it's really something to look at. There's something immediate you have to take care of.
Right, that you're in
And then is
serious
it with
trouble.
yeah, there's really something going on. And
Hmm.
then the other way to look at it is it within those optimal values? So you look at it two different ways. And then the other thing that's really important about lab work too is you look at it in terms of the relationships between things. So lab value doesn't exist by itself. It exists in relationship to other things that represent either that particular chemistry or that particular organ or system or related systems. And so you have to contextualize lab together to really understand it. And a lot of and that's something that's commonly not done. And
Hmm.
and it's a real important concept to provide good
Contextualize,
care.
can you give an example of contextualizing something with the lab work?
Yeah, so it's real common for people to have a low normal carbon dioxide on a metabolic panel. And so the classic norm is anything from 20 to 30 is considered normal for a CO2. But really, if you get to around 24 or less on a CO2 level, that you're underproducing carbon dioxide. And where that comes from is the primary place that you produce carbon dioxide is from uh, turning sugar into energy inside the mitochondria and cells. So when you take glucose, you turn it into ATP, you produce carbon dioxide as a waste product, and so that's a real important part of the body's systems is to have is to produce the carbon dioxide and then be able to use the carbon dioxide as part of different systems. And so if you're low normal carbon dioxide, you're nearly always underproducing energy at the cellular level. And so that immediately decreases a person's resistance, decreases their resilience, makes them more compromised. So then if they experience a trauma or an infection or some other insult to their system, they don't have enough energy to recover. And they just don't get well. And then there's a whole cascade of things that then happen. You build something called lactic acidosis in the tissues, and that lactic acidosis causes inflammation and fatigue and achiness and foggy headedness and a whole bunch of other problems. And then if you don't produce enough CO2, you can't make bicarbonate. And bicarbonate is the primary way that you balance the pH in your body. So then you'll start using magnesium and potassium and calcium as secondary buffers to the system. So then you're always needing those to feel okay. So typically for people that need magnesium, they actually don't produce enough carbon dioxide because they don't produce enough energy in their cells. So that's contextualizing things.
Going to the bigger underlying thing which gives rise to the rest. Is that the same sort of thing?
Yes.
Okay.
As a theme, if you're using a systems-based approach, you always want to distill things down to their lowest common denominator. So you look at things like, is the body actually able to transcribe a gene to an enzyme efficiently? That's a real basic question. And then another question, is the cell able to produce enough energy to function? That's another really important question. Mm-hmm. And then there's the question of oxidation. Can the body control the oxidation? Because when you produce energy, you produce free radicals. And so if you're not able to control that, it's going to cause inflammation and break the tissues down. So you have to ask those really basic things. Another real basic question is do you have a balance in the autonomic or unconscious nervous system? Are you in a fight or flight state, or are you in a relaxed state?
Got it.
It's really important to have a balance between the two. So those are real fundamental questions, because very commonly, especially people with very complex illnesses, health problems, they have dysautonomia. Their autonomic nervous system is not calibrated. And so they have 30 different symptoms, and they all relate to that. So
I would imagine most people who walk in your door are, fight or flight dominant, sympathetic dominant. I mean,
it's really common.
Yeah.
It's really
There's this isn't ideal for sure. This is not the best way to practice as an Ayurvedic practitioner, but in Ayurveda, the yogic Indian science of nutrition and medicine and all that.
Yeah.
The Vata, Pitta, Kapha, the doshas. Vata are the individuals are the qualities of anxiety, fast movement, imbalance in those directions versus kapha, which is heavy and more depressive. And
right,
when they're doing
those at a real basic level relate to the autonomic nervous system.
Right. And so what I was going to say is that one of the approaches that my teacher, who I just did like 80 hours with, she said, when in doubt, treat vata, because basically everybody comes in with a vata. Almost everybody has a vata imbalance. Almost everybody errs on the side of anxiety. I would say even if they're in depression, the other side of depression, anxiety, it's kind of just like from my own experience.
Yeah. Because depression commonly comes from chronic overstimulation to the nervous system. And then depression comes after that, as a result of that.
We should probably do a session just on depression.
We could do that.
I think it would be really helpful to a lot of people, especially with what you just said. That last statement about where it comes from.
Yeah, it's not understood.
Yeah.
There is a large group of depression that doesn't relate to serotonin. It doesn't relate to the catecholamines like dopamine and
oh, that's interesting. I didn't really know that.
Norepinephrine and epinephrine, that they